Hello, it's Saturday, August 29th. Dr. Nardone, I'm back after several weeks. I'm back to give a brief update on some very promising news about COVID 19 and also about people in general. First of all, it appears that by the end of this year, we may very well have a vaccine. Now, of course, it's not going to be available to all and everyone at once, but that is a lot better place to be than we were 6 months ago. So let's hope moving forward that by the end of 2020, there is a vaccine available in the United States. Secondly, Abbott Labs got emergency use authorization by the FDA for their COVID 19 antigen test card. This is a small little card whereby a little swab from the nares is taken and it is placed on the card, and an antigen is detected using a reagent. The beauty of this test is that yes, it is rapid. You can get results within 15 minutes. It is portable. It is very inexpensive. They're saying it'll be maybe just $5. It can be used in doctor's office, nurse's office, even pharmacists, urgent care centers. So there's the availability is to other professionals and other settings is there. And the other thing about it is that it detects an antigen. An antigen is different than what we're detecting with the PCR tests that take longer to do. In those tests, the PCR is called polymerase chain reaction. Those tests were actually trying to detect RNA of the virus. In this test, it's an antigen is a protein of the virus, and it's going to detect a very specific protein for SARS-CoV-2. And because of that specificity of that protein, the test is very sensitive. So if there is COVID-19 there, it will pick it up, and it's very specific for the virus. Those are two good features for any test. And as a gynecologist, I use pregnancy tests in the office all the time. This is being compared to a similar thing. It's a qualitative test of this antigen. So by September, Abbott Labs hopes to ship millions of these tests all over the US. Let's hope that they do become available and do come through for us, because this is a game changer for detection, for tracking, for seeing trends, for screening, all of the above. And last but not least, I do want to mention that I heard some very promising information today regarding that the enrollments in nursing schools and healthcare professional schools, medical schools, even first-line responder schools has seen an uptick in enrollees. In spite of all of the toll you saw that COVID-19 took on first responders, nurses, doctors, healthcare workers, janitors, hospitals, you name it, in spite of the mental, physical, and emotional toll that taking care of these sick patients took on these people, it appears that people want to go into these professions in spite of that. And I am very encouraged to hear that. And kudos to those of you that want to put yourselves there and help others. And I think that speaks to the fact that, in fact, humankind is mostly good and feels good when they're doing good for other humans. So on that note, keep your faith stronger than your fears. Goodbye.